All right, so let's review removal of a tracheostomy tube and insertion of a new tracheostomy tube. So I'm going to replace this tracheostomy tube with the 7.0 Portex tracheostomy. So I'm going to open this box up. We'll show you the contents. It should have a obturator. It's got a new set of tracheostomy tube ties as well, so that'll be good. I can change those out if warranted. If they're soiled, and make sure we change those out. I've also got a tracheostomy tube care kit that I can utilize, but I'll do trach care in the next one. This video is just going to focus on changing out a tracheostomy tube. So with that tracheostomy tube there, some of them are cuffed, some of them are uncuffed. This one happens to have a disposable intercannulus, so this should at least at a minimum be changed at least once a shift. And those come sterile packaged. So for instance, the tracheostomy tube I'm getting ready to put into this patient, being a different size than what we have in here already, has different size disposable intercannula, and it comes in a sterile packaging. So we'll utilize that here momentarily. But that goes in and out, and they have different variations. You've got your Portex tracheostomy tube, Shiley tracheostomy tube, so the mechanism for which they can actually connect to the hub of the tracheostomy tube are a little bit differently, but this one just tends to click into place. And you want to make sure that you keep that clean. There's a little tab that you can hang on to. Make sure that you don't let this touch nothing before you would put the disposable intercannula back in there, because it really should be as sterile as possible placing that in there. So there's a balloon on or a cuff on the tip of that tracheostomy tube that seals off the airway. So what I do, I let the patient know we're going to change out your tracheostomy tube. So your patient may be on a tracheostomy collar. We'll assume for the purpose of what we're doing that this patient is okay with room air. You can still provide a couple of breaths of 100% hyperoxygenation before you pull the airway out, and we'll do that momentarily. But there's a lot of moving parts. If you needed a second person to help you out while they're breathing for, while you're getting your stuff together, you can absolutely do that. So open up your new suction cath or tracheostomy tube, and this happens to be an uncuffed tracheostomy tube, so we'll operate with what we've got. Got surgical lube ready to go. If this were a cuffed tracheostomy tube, one thing you would want to do would be pull this tubing out of the package and inflate that cuff and make sure that it holds air pressure, because you want to make sure that cuff it's useless to put a tracheostomy tube inside of someone that's not going to be able to have a cuff. If you need a sealed airway and that cuff won't seal the airway, you want to make sure that you avoid that. So you test that cuff out initially. So the tracheostomy tube, again, this should be a sterile procedure. I will say this though, if everything from the flange upward, as long as you're not touching anything else inside of this package, you should be all right. But to get it prepped, I'll go ahead and put sterile gloves on so that we can show you what's going on, and we'll pretend that I just opened that and haven't touched anything inside of it. So again, you can take your sterile gloves. I'm going to step off frame and because I'm running out of room to work with, so I'll open these up. And before I don and put on those sterile gloves, you can take your lubricating jelly and squirt it inside of the, or you can actually squirt it on your tracheostomy tube if you like. Go ahead and put your sterile gloves on. And now that you got your sterile gloves, you can touch whatever you want to inside of that packaging. So if I needed to, I squirted some jelly inside of there. Make sure that you lubricate the tip of not the very tip. You don't want to occlude the airway. You've also got the obturator that you can put inside of your tracheostomy tube. This is going to give you something to hold and press in when you're changing out the tracheostomy tube. So make sure that you've got that lubed up and ready to go. As long as you are, like if you didn't have sterile gloves on, as long as you're holding this in, the end that's not going to go into the patient, you could take your lubricating jelly and with a full packet, run that up and down the tracheostomy tube. And because the contents of this is sterile, as long as you don't touch that with the packaging, that's still going to be sterile. And so you could technically do this without sterile gloves on, but you want to make sure this side of the tracheostomy tube stays sterile and that you're not touching anything in regard to the actual tube that's going to go into the throat. So I'm going to set that aside because now I've got to touch this, so I can't be sterile. So I'm no longer sterile in this regard. So now what I'm going to do is you can take and work this loose. There may be some secretions or what have you. Have suction ready to go in the event that you need it. And then you've hyperoxygenated your patient. So we'll take and deflate the cuff after you've worked the tracheostomy ties loose. So you can do both sides. If you wanted to do just one side, it's up to you. But now you can deflate the cuff and have this one pulled out. Pull that one out with the cuff deflated. And now, while you've got visualization of the hole in the neck or your stoma and the opening to the tracheostomy tube, you can take your new tracheostomy tube with the obturator in and push it into place. And it'll settle into place. Once you've done this, pull the obturator out, and now you can take your tracheostomy tube ties, and secure the tracheostomy tube. Because if this patient were to cough, especially with this being uncuffed, it could shoot the tracheostomy tube out of their throat, out of their neck. So just make sure that you keep that tracheostomy tube secure. And if you need to, you could have a tracheostomy collar set up, a tracheostomy tube collar set up so that you can provide free flow oxygen if the patient needs it. And then we're going to come underneath the head with this new tie. With the new tie, secure it into place. Again, snug enough to be able to get 2 fingers worth up under it. You don't want it to be too loose. Then you've got a new inner cannula to put in, so make sure that you don't touch this side of that inner cannula, and slide your inner cannula into place. And then last but not least, a brand new trach gauze. What I like to do is get it up under the flange, pull one set up a little bit, take the other, sneak it up under the flange, and then you can grab both of them, snug that up, and make it nice and neat so that you've got an appropriate gauze on there. And if this patient is requiring supplemental oxygenation, then you can then go through and put your tracheostomy collar back on top of that. If this were I put in an uncuffed tracheostomy tube. If it were a cuffed tracheostomy tube, after you put the tracheostomy tube in, you would want to make sure that you inflated that cuff, the cuff. You've pulled the obturator out, you've inflated the cuff, and then last but not least, just like with an endotracheal tube, you'll check your cuff pressure as well. So that is changing out an insertion of a tracheostomy tube. We'll leave this one. We'll leave this so that we can continue to practice with it, but that's it for this video.